You are watching McLaren Port Huron Today's Health Program, and I'm speaking with radiation oncologist Dr. Matthew Johnson from the Karmanos Cancer Institute at McLaren Port Huron about advancements in radiation treatment for breast cancer. Dr. Johnson, thanks so much for speaking with us today.
Thanks for having me.
Can you tell us a little bit about what exactly is radiation therapy?
Sure. So radiation is one of the ways that we use to treat cancer alongside surgery, chemotherapy, other medications. And basically what it is it's x-rays, and it's a focused treatment. It's not like a medication that goes through your whole body. It's something that we would treat. In this instance, we would point it at the breast with the goal of killing the cancer cells that might be there. Typically, the radiation for breast cancer is something that's done after the surgery, just to try and clean up if there's any microscopic disease or anything like that.
Very good. What are some of the common questions that patients have for you?
So radiation is one of those things, there's a lot of misconceptions out there about. People tend to worry that it's a full body treatment or they'll be radioactive afterwards, and those aren't true. So radiation is, and it also doesn't cause pain or anything like that. Radiation is a focused treatment. It really is only going to cause side effects potentially where we point the radiation. So some patients, especially for breast cancer, worry that if they need radiation, they'll lose their hair or have nausea, vomiting, diarrhea, and really none of that's the case. Really the main side effects are mostly related to the breast, the skin of the breast, and generally women can have a little bit of fatigue as well.
So tell us a little bit about the treatment that's available right here at McLaren Port Huron.
Sure. So for women with breast cancer, we primarily use an external radiation therapy, and that's where the radiation beam comes from outside of the patient from a machine called a linear accelerator. And we typically treat patients depending a little bit on their disease characteristics. It's often a daily treatment for breast cancer. Typically it's given 5 days a week. For some women, especially with earlier stage disease, their treatments might be done in as short as 3 weeks. And there's even some very favorable patients that might only need 1 week of treatment, although they would be going a couple times a day. And some patients who have maybe a little more disease involvement, they might be a little closer to 6 weeks of treatment. So everyone's a little different, but the main way we deliver the radiation is externally.
So tell me what the patient would experience. So a patient comes into the department, kind of walk us through what they would experience.
So, the first thing always is a consultation where we talk to them, we meet with them about their specific case, and the first thing they would actually have done is something called a CT simulation or a planning scan. That's where when somebody comes in for radiation, because we're trying to treat the same exact spot every day, we want them in the same position every day. So we typically for breast cancer will have women lay down, we have them put their arms behind their head like this, and we do a scan, a CAT scan, just for our radiation planning. This isn't something where we put contrast in their veins. We don't send it to the radiologist to look at it. It's just for our planning use. And after that planning scan, it takes us a few days, maybe a week, to do all of our treatment planning. And then once the patient's ready to start, they come to the treatment 5 days a week. They're usually in and out pretty quick, maybe like a half hour each day, door to door. 1 day a week, they check in with myself or our nurses just to make sure everything's going okay. And basically we ask them, how they're tolerating the treatment.
So part of that initial planning session really helps you determine what type of treatment that the patient will receive then too?
Sure, yeah, and really a lot of times we have a pretty good idea from kind of upfront from the surgery and the clinical stage what the patient might require. So we're able to give the patient a pretty good idea before they even lay down for the planning scan what we're thinking as far as how long the treatment will be, what side effects to expect.
So what are some of the advantages for our patients that are treated here at McLaren Port Huron?
So we definitely have a lot of advantages, and I know I know you guys had talked earlier about the NAPBC. So we recently received accreditation for being a breast center of excellence, and one of the advantages is people can get comprehensive multidisciplinary care all in one spot. So typically when patients come to see us, they meet with the surgeons, they'll meet with ourselves, with medical oncology. We meet several times a month in what's called a tumor board, where we actually discuss patients individually. So usually before a patient even starts down the road of deciding, how to approach their treatment, the doctors have already met and discussed what they think together is the best course. I think that we have very good multidisciplinary care. We have people who are dedicated and do a lot of breast treatments and surgeries, and we really have a pretty good streamlined process for seeing patients and getting them set up and getting them where they need to go for treatment.
And we are a Karmanos Cancer Institute, so we also have access then to services?
Oh, absolutely. So one of the really nice things about being part of Karmanos is that we have several clinical trials open just for breast cancer alone. So patients, if they're interested, can be part of studies, and patients also have resources, in connection with Karmanos. And really, Karmanos also oversees a lot of what we do and just make sure that we're delivering really high quality care locally.
So can you tell us, is there any special technology that's available here for our patients?
So obviously we do have very up-to-date technology, especially considering we've just opened in the last few years. One of the important things in breast cancer treatment is for women who have left-sided breast cancers, the radiation therapy can sometimes be close to the heart. And we actually use a special technology called Vision RT or Align RT. And what that allows us to do is we have women who have this left-sided breast cancer. We actually have them hold their breath during the treatment. They take a breath and they hold it. This special software monitors their chest wall, making sure they've achieved appropriate depth. And then if they lose their breath or there's any cough, it actually will turn the beam off. So it's an extra way to just make sure that the patients are getting as low or basically no radiation to the heart. And that used to be a problem years ago, was we didn't have any kind of techniques to avoid the heart, so we would sometimes expose the heart more than we wanted to. And nowadays we're able to make it so that almost any patient walking in the door would have a negligible, if any, dose to the heart.
That's great. Good. Thank you so much for joining us today. I think this information will be very beneficial for our audience.
Okay, well, hey, thanks for having me.
We do need to take a short break, but we will continue this discussion when we return.